CNA exam practice test questions. Question 1. A physician tells the nurse aide that a patient's Foley catheter can be removed. What should the nurse aide do? Option A. Remind the physician that nurse aides cannot take orders and offer to get a nurse. Option B. Remove the catheter immediately. Option C. Ask the patient if they want it removed. Option D. Wait for the next shift. The correct answer is option A. Remind the physician that nurse aides cannot take orders and offer to get a nurse. Remind the physician that nurse aides cannot take orders and offer to get a nurse. Question 2. A patient who has been withdrawn and unhappy suddenly appears more cheerful and has begun to give away many belongings to other patients. What should the nurse aide do? Option A. Alert the nurse to a change in the patient's mood. Option B. Ignore the change. Option C. Give the belongings back. Option D. Tell the patient to be quiet. The correct answer is option A. Alert the nurse to a change in the patient's mood. Alert the nurse to a change in the patient's mood. Question 3. A patient was diagnosed with advanced pancreatic cancer and has been experiencing much nausea and pain. Although aware of the diagnosis, the patient claims that the cause of the problems is food poisoning from a poor diet. Which of the following is the patient is likely experiencing? Option A. Denial. Option B. Anger. Option C. Bargaining. Option D. Depression. The correct answer is option A. Denial. Denial. Question 4. Which of the following is the primary purpose of applying a footboard to a patient's bed? Option A. Prevent the patient from developing foot drop. Option B. Pressure sores. Option C. Infection. Option D. Muscle atrophy. The correct answer is option A. Prevent the patient from developing foot drop. Prevent the patient from developing foot drop. Question 5. If a patient is on bed rest, the most important measure to prevent skin breakdown is to do which of the following? Option A. Turn the patient at least every 2 hours. Option B. Massage bony prominences. Option C. Apply lotion every hour. Option D. Keep the bed flat. The correct answer is option A. Turn the patient at least every 2 hours. Turn the patient at least every 2 hours. Question 6. The nurse aide is walking with a patient who calls out, "Help, I'm falling." What is the best initial action? Option A. Ease the patient onto the floor. Option B. Try to catch the patient. Option C. Call for help and stand back. Option D. Grab the patient's arm. The correct answer is option A. Ease the patient onto the floor. Ease the patient onto the floor. Question 7. The nurse aide must move a box of supplies weighing 15 pounds from the lowest shelf in a supply room to a nursing station. Which of the following is the best method to do this? Option A. Squat down and grip the box with both hands to pull and lift. Option B. Bend at the waist. Option C. Use a back brace. Option D. Ask a patient for help. The correct answer is option A. Squat down and grip the box with both hands to pull and lift. Squat down and grip the box with both hands to pull and lift. Question 8. When a nurse aide observes another nurse aide mishandling and swearing at a confused patient, what should be the initial action? Option A. Intervene to stop abuse. Option B. Report it at the end of the shift. Option C. Tell the patient it's okay. Option D. Ignore it. The correct answer is option A. Intervene to stop abuse. Intervene to stop abuse. Question 9. The nurse aide is transferring a patient from a wheelchair to the patient's bed. Once the wheelchair is in position, what should the next action be? Option A. Lock the wheelchair so that it does not move. Option B. Unlock the brakes. Option C. Remove the footrests. Option D. Tell the patient to stand up. The correct answer is option A. Lock the wheelchair so that it does not move. Lock the wheelchair so that it does not move. Question 10. If a fire occurs on the unit, and the nurse aide is using the race method of response, what should the first action be? Option A. Remove patients from harm. Option B. Extinguish the fire. Option C. Contain the fire. Option D. Activate the alarm. The correct answer is option A. Remove patients from harm. Remove patients from harm. Question 11. If a patient accidentally spills hot coffee on her hand, what should the nurse aide immediately do? Option A. Flush the burn with cold water. Option B. Apply butter. Option C. Apply ice. Option D. Cover with a tight bandage. The correct answer is option A. Flush the burn with cold water. Flush the burn with cold water. Question 12. The nurse aide has a number of routine tasks to complete, but the licensed nurse asks the nurse aide to measure a patient's urinary catheter output. Which of the following tasks should have priority? Option A. Assisting a patient who is calling loudly for a bedpan. Option B. Remove the catheter immediately. Option C. Ask the patient if they want it removed. Option D. Wait for the next shift. The correct answer is option A. Assisting a patient who is calling loudly for a bedpan. Assisting a patient who is calling loudly for a bedpan. Question 13. A patient who is partially paralyzed and unable to assist with transfer must be transferred from the bed to a bedside commode. What is the best method of moving the patient? Option A. Utilize a Hoyer lift. Option B. Use a gait belt. Option C. Two-person manual lift. Option D. Encourage the patient to walk. The correct answer is option A. Utilize a Hoyer lift. Utilize a Hoyer lift. Question 14. Which of the following is a normal age-related change in memory? Option A. The patient sometimes forgets to keep appointments. Option B. Forgetting family members' names. Option C. Getting lost in the house. Option D. Inability to follow simple instructions. The correct answer is option A. The patient sometimes forgets to keep appointments. The patient sometimes forgets to keep appointments. Question 15. If a patient in the recreation room falls to the floor and has no pulse or respirations, what should the nurse aide immediately do? Option A. Use the emergency light to call for a nurse. Option B. Wait for a family member. Option C. Start a bath. Option D. Call the doctor's office. The correct answer is option A. Use the emergency light to call for a nurse. Use the emergency light to call for a nurse. Question 16. A patient who is sitting up in bed experiences a generalized seizure while the nurse aide is providing care. The nurse aide should call for the nurse and then do what? Option A. Lower the head of the bed and turn patient to one side. Option B. Place a padded tongue blade in the mouth. Option C. Restrain the patient's limbs. Option D. Hold the patient down. The correct answer is option A. Lower the head of the bed and turn patient to one side. Lower the head of the bed and turn patient to one side. Question 17. A patient with diabetes mellitus, type 1, received insulin before lunch but ate little and is now confused and trembling, and the patient's skin is cold and clammy. The nurse aide should do which of the following? Option A. Use the emergency light to call for a nurse. Option B. Give the patient a glass of water. Option C. Tell the patient to take a nap. Option D. Offer a sugar-free snack. The correct answer is option A. Use the emergency light to call for a nurse. Use the emergency light to call for a nurse. Question 18. An older patient has been sitting up in bed but has slid down the bed about 6 inches. When the nurse aide repositions the patient, the nurse aide notes that the coccygeal, tailbone, area is reddened. In addition to notifying the nurse aide should do which of the following? Option A. Position the patient on a side. Option B. Massage the area. Option C. Apply heat. Option D. Do nothing. The correct answer is option A. Position the patient on a side. Position the patient on a side. Question 19. The nurse aide goes into a room and discovers that the patient has a large bleeding skin tear on the right arm. The nurse aide calls for the nurse, applies gloves, and then should do which of the following? Option A. Raise the arm and apply pressure with sterile gauze or clean linen. Option B. Wash it with soap and water. Option C. Apply a tourniquet. Option D. Leave it open to air. The correct answer is option A. Raise the arm and apply pressure with sterile gauze or clean linen. Raise the arm and apply pressure with sterile gauze or clean linen. Question 20. When examining a patient's skin during a bath to check for pressure sores, what should the nurse aide focus on? Option A. Bony prominences. Option B. Large muscles. Option C. Abdomen. Option D. Fatty tissue. The correct answer is option A. Bony prominences. Bony prominences. Question 21. If a patient assigned to the nurse aide is in arm restraints because the patient is pulling her hair out, how often must the patient be temporarily released while awake? Option A. At least once every 2 hours. Option B. Once every 4 hours. Option C. Once per shift. Option D. Only when the patient asks. The correct answer is option A. At least once every 2 hours. At least once every 2 hours. Question 22. Following right hip transplantation, the patient has been told to avoid adduction. This means that the patient should not do which of the following? Option A. Cross the right leg over the left. Option B. Keep legs apart. Option C. Elevate the legs. Option D. Bend the knees. The correct answer is option A. Cross the right leg over the left. Cross the right leg over the left. Question 23. A newly arrived patient yells that the nurse aide is stupid and careless when helping the patient to unpack their belongings. What is the most appropriate response? Option A. Remain calm and express empathy. It's difficult to have other people handling your things. Option B. Tell the patient they are being rude. Option C. Leave the room immediately. Option D. Yell back. The correct answer is option A. Remain calm and express empathy. It's difficult to have other people handling your things. Remain calm and express empathy. It's difficult to have other people handling your things. Question 24. For what reason can restraints be applied to patients? Option A. Medical symptoms or needs. Option B. Once every 4 hours. Option C. Once per shift. Option D. Only when the patient asks. The correct answer is option A. Medical symptoms or needs. Medical symptoms or needs. Question 25. For which patients are standard precautions required? Option A. All patients. Option B. Patients with known infections. Option C. Only surgical patients. Option D. Only elderly patients. The correct answer is option A. All patients. All patients. Question 26. Which of the following is a risk factor for elopement? Option A. Staying near exists. Option B. Being oriented to time and place. Option C. Participating in group activities. Option D. Sleeping through the night. The correct answer is option A. Staying near exists. Staying near exists. Question 27. A patient has influenza with a high fever and cough. What type of precaution is/are indicated? Option A. Standard and droplet. Option B. Airborne. Option C. Contact only. Option D. Protective environment. The correct answer is option A. Standard and droplet. Standard and droplet. Question 28. Which of the following abbreviations is appropriate to use in documentation? Option A. ABD, abdomen. Option B. U, units. Option C. QD, every day. Option D. MS, morphine sulfate. The correct answer is option A. ABD, abdomen. ABD, abdomen. Question 29. Which of the following contributes most to the spread of infection in the workplace? Option A. Poor hand hygiene. Option B. Using personal protective equipment. Option C. Clean environment. Option D. A proper disposal of sharps. The correct answer is option A. Poor hand hygiene. Poor hand hygiene. Question 30. If nurse aides have verified complaints filed against them on the nurse aide registry, what will be the result? Option A. They will lose certification permanently. Option B. Be fined. Option C. Be suspended for a week. Option D. Receive a warning. The correct answer is option A. They will lose certification permanently. They will lose certification permanently. Question 31. Which of the following is a common sign of impending death? Option A. Irregular shallow, Cheyne-Stokes, breathing pattern. Option B. Rapid breathing. Option C. Increased appetite. Option D. High blood pressure. The correct answer is option A. Irregular shallow, Cheyne-Stokes, breathing pattern. Irregular shallow, Cheyne-Stokes, breathing pattern. Question 32. Which of the following is appropriate in documenting patient care? Option A. Writing in black or blue permanent ink. Option B. Pencil. Option C. Red ink. Option D. Erasable pen. The correct answer is option A. Writing in black or blue permanent ink. Writing in black or blue permanent ink. Question 33. Which is an example of information about a patient that requires urgent rather than routine reporting? Option A. Blood and stool. Option B. Patient's preference for lunch. Option C. A missed nap. Option D. A request for a magazine. The correct answer is option A. Blood in stool. Blood in stool. Question 34. The nurse aide notes that a patient has bruises on both arms and seems increasingly fearful and withdrawn. What should the nurse aide suspect? Option A, abuse. Option B, aging. Option C, poor nutrition. Option D, side effects of medication. The correct answer is option A, abuse. Abuse. Question 35. A patient who does not eat pork for religious reasons but is increasingly confused because of Alzheimer's disease is sent a lunch tray with a ham sandwich. What should the nurse aide do? Option A, remove the ham sandwich and order a replacement. Option B, force the patient to eat it. Option C, tell the patient it's not pork. Option D, leave the tray as is. The correct answer is option A, remove the ham sandwich and order a replacement. Remove the ham sandwich and order a replacement. Question 36. If a nurse aide believes that the work assignments are unfair, the nurse aide should first take the concern to whom? Option A, their immediate supervisor. Option B, the administrator. Option C, the patient's family. Option D, a coworker. The correct answer is option A, their immediate supervisor. Their immediate supervisor. Question 37. A patient's daughter asks a nurse aide what is wrong with another patient, who recently had a stroke, in an adjoining room. What would be an acceptable response? Option A, I'm sorry, I can't give out information about patients. Option B, tell the daughter about the stroke. Option C, tell her to ask the nurse. Option D, give her the patient's chart. The correct answer is option A, I'm sorry, I can't give out information about patients. I'm sorry, I can't give out information about patients. Question 38. A patient who is mentally alert refuses to take a shower in the morning, preferring to take it after lunch. What should the nurse aide do? Option A, respect the patient's wishes. Option B, force the patient to shower. Option C, report the patient for being non-compliant. Option D, call the family. The correct answer is option A, respect the patient's wishes. Respect the patient's wishes. Question 39. If a patient begins to choke while the nurse aide is assisting the patient with eating lunch, the nurse aide should immediately call for the nurse and then do what? Option A, ask the patient if able to speak or cough. Option B, perform the Heimlich maneuver immediately. Option C, give the patient a drink of water. Option D, slap the patient on the back. The correct answer is option A, ask the patient if able to speak or cough. Ask the patient if able to speak or cough. Question 40. A patient has developed frequent constipation. In addition to increasing fluid intake, what other dietary change may help to relieve the constipation? Option A, increased fiber. Option B, increased protein. Option C, increased dairy. Option D, increased sugar. The correct answer is option A, increased fiber. Increased fiber. Question 41. For which of the following patients is taking an oral temperature appropriate? Option A, a patient who has slight nausea. Option B, a patient who just drank hot coffee. Option C, a patient who is unconscious. Option D, a patient who is mouth breathing. The correct answer is option A, a patient who has slight nausea. A patient who has slight nausea. Question 42. When assisting a patient to ambulate with a walker after hip replacement surgery, the nurse aide should remind the patient to move the walker forward about how far? Option A, 6 to 10 inches. Option B, 2 to 4 inches. Option C, 12 to 18 inches. Option D, 20 to 24 inches. The correct answer is option A, 6 to 10 inches. 6 to 10 inches. Question 43. When transferring a patient from a bed to a wheelchair, how high should the bed be? Option A, 1 to 2 inches higher than the seat of the wheelchair. Option B, unlock the brakes. Option C, remove the footrests. Option D, tell the patient to stand up. The correct answer is option A, 1 to 2 inches higher than the seat of the wheelchair. 1 to 2 inches higher than the seat of the wheelchair. Question 44. Pressure-reducing heel boots are intended for which patients? Option A, those who are not ambulatory. Option B, ambulatory patients. Option C, patients with fractures. Option D, all patients. The correct answer is option A, those who are not ambulatory. Those who are not ambulatory. Question 45. According to Maslow's hierarchy of needs, which of the following needs is the most important to meet first? Option A, physiological. Option B, self-actualization. Option C, safety. Option D, love and belonging. The correct answer is option A, physiological. Physiological. Question 46. An older patient who takes a 3-hour nap every afternoon is concerned because she is unable to sleep more than 4 or 5 hours at night. The nurse aide tells the patient that the average number of hours of needed sleep, including nap time, is option A, 7 to 9, option B, 4 to 5, option C, 10 to 12, option D, 12 to 14. The correct answer is option A, 7 to 9. 7 to 9. Question 47. When assisting a male patient to use a urinal, what is the ideal position of the head of the bed? Option A, elevated to 80 to 90 degrees. Option B, flat. Option C, elevated to 30 degrees. Option D, elevated to 45 degrees. The correct answer is option A, elevated to 80 to 90 degrees. Elevated to 80 to 90 degrees. Question 48. When feeding a bedbound patient, the patient should, if possible, have the head elevated to at least what level? Option A, 45 degrees. Option B, flat. Option C, 30 degrees. Option D, 15 degrees. The correct answer is option A, 45 degrees. 45 degrees. Question 49. A patient with diabetes mellitus asks the nurse aide to help to trim his toenails. How should the nurse aide proceed? Option A, explain that a nurse or podiatrist must trim the nails. Option B, give the patient a glass of water. Option C, tell the patient to take a nap. Option D, offer a sugar-free snack. The correct answer is option A, explain that a nurse or podiatrist must trim the nails. Explain that a nurse or podiatrist must trim the nails. Question 50. A patient is on a low-fat diet. Which of the following foods is likely to be restricted? Option A, steak. Option B, chicken breast. Option C, broccoli. Option D, apples. The correct answer is option A, steak. Steak. Question 51. A patient who is dying tells the nurse, "I used to have such an interesting life." What is the best response? Option A, I'd like to hear about your life. Option B, tell the patient everyone has an interesting life. Option C, change the subject. Option D, tell the patient to focus on the present. The correct answer is option A, I'd like to hear about your life. I'd like to hear about your life. Question 52. If a patient has a prosthetic leg, how should the patient's routine weight be taken? Option A, consistently with the prosthetic leg either on or off. Option B, always with it off. Option C, always with it on. Option D, it does not matter. The correct answer is option A, consistently with the prosthetic leg either on or off. Consistently with the prosthetic leg either on or off. Question 53. Which of the following may best provide reality orientation for a patient with mild cognitive impairment, confusion? Option A, providing calendars, clocks, pictures, and signs. Option B, keeping the room dark. Option C, limiting visitors. Option D, changing the routine daily. The correct answer is option A, providing calendars, clocks, pictures, and signs. Providing calendars, clocks, pictures, and signs. Question 54. The nurse aide enters a patient's room and finds the patient tearful and obviously upset. Which of the following would be the most appropriate response? Option A, observe, you seem upset this morning. Option B, wash it with soap and water. Option C, apply a tourniquet. Option D, leave it open to air. The correct answer is option A, observe, you seem upset this morning. Observe, you seem upset this morning. Question 55. The nurse aide is caring for a patient who is non-responsive and is doing passive range of motion (ROM) exercises. Which of the following ROM exercises are indicated for the ankle? Option A, inversion, turning in, evershaun, turning out, flexion, and extension. Option B, abduction and adduction. Option C, a rotation of the knee. Option D, a circumduction of the hip. The correct answer is option A, inversion, turning in, evershaun, turning out, flexion, and extension. Inversion, turning in, evershaun, turning out, flexion, and extension. Question 56. What is the primary purpose of the kidneys? Option A, remove waste products and produce urine. Option B, pump blood. Option C, digest food. Option D, exchange oxygen. The correct answer is option A, remove waste products and produce urine. Remove waste products and produce urine. Question 57. The nurse aide awakens a patient and notes that, for the first time, the patient's right arm seems weak and the patient's speech is slow and slurred. How should the nurse aide respond? Option A, call the nurse immediately. Option B, wait to see if it improves. Option C, tell the patient to rest. Option D, document it at the end of the day. The correct answer is option A, call the nurse immediately. Call the nurse immediately. Question 58. A patient who is frequently unfriendly and complains about staff members and other patients claims that the staff and patients all dislike him. This is an example of which defense mechanism? Option A, projection. Option B, rationalization. Option C, regression. Option D, sublimation. The correct answer is option A, projection. Projection. Question 59. When entering the room of a patient who is deaf but sitting turned away, the nurse aide should: Option A, tap a foot or clap before entering. Option B, shout from the doorway. Option C, touch the patient's shoulder suddenly. Option D, turn the lights on and off. The correct answer is option A, tap a foot or clap before entering. Tap a foot or clap before entering. Question 60. The nurse aide is bringing colostomy supplies to a patient who is blind. When putting the supplies away, what should the nurse aide say? Option A, I'm putting the colostomy supplies in the drawer under the sink in your bathroom. Option B, large muscles. Option C, abdomen. Option D, fatty tissue. The correct answer is option A, I'm putting the colostomy supplies in the drawer under the sink in your bathroom. I'm putting the colostomy supplies in the drawer under the sink in your bathroom. Question 61. When changing a patient's colostomy bag, which of the following should the nurse aide report immediately to the nurse? Option A, the stoma is dusky bluish in appearance. Option B, pink. Option C, moist. Option D, or red. The correct answer is option A, the stoma is dusky bluish in appearance. The stoma is dusky bluish in appearance. Question 62. The nurse aide finds a plastic bag full of assorted pills in the back of a patient's bedside table. The patient states they are vitamins. What should the nurse aide do? Option A, report the observation to the nurse. Option B, flush them down the toilet. Option C, give them to the patient. Option D, throw them in the trash. The correct answer is option A, report the observation to the nurse. Report the observation to the nurse. Question 63. An Asian patient's spouse died recently, but the patient expresses little emotion about the spouse's death. What does this likely mean about the patient? Option A, the patient prefers not to show grief outwardly. Option B, rapid breathing. Option C, increased appetite. Option D, high blood pressure. The correct answer is option A, the patient prefers not to show grief outwardly. The patient prefers not to show grief outwardly. Question 64. A patient has been nauseated and vomiting frequently for the last 3 to 4 hours. Which of the following types of vomitus/emesis should the nurse aide report immediately to the nurse? Option A, coffee ground appearing vomitus. Option B, apply butter. Option C, apply ice. Option D, cover with a tight bandage. The correct answer is option A, coffee ground appearing vomitus. Coffee ground appearing vomitus. Question 65. A patient is on a low-carbohydrate, limited-calorie diabetic diet, but the nurse aide finds a box of chocolates in the patient's room. The nurse aide should do which of the following? Option A, alert the nurse about the chocolates. Option B, bend at the waist. Option C, use a back brace. Option D, ask a patient for help. The correct answer is option A, alert the nurse about the chocolates. Alert the nurse about the chocolates. Question 66. What is the universal sign of choking? Option A, grabbing at the throat. Option B, coughing. Option C, pointing at the mouth. Option D, raising hands. The correct answer is option A, grabbing at the throat. Grabbing at the throat. Question 67. If a patient with a history of a mental disorder becomes very violent and begins screaming and throwing things at the nurse aide, what should the nurse aide do? Option A, get to safety and call the nurse. Option B, try to restrain the patient. Option C, argue with the patient. Option D, ignore the behavior. The correct answer is option A, get to safety and call the nurse. Get to safety and call the nurse. Question 68. A patient with moderate dementia has gotten out of bed during the night a number of times and gotten lost in the facility and grounds. Which of the following may provide the best solution? Option A, utilizing a wander management system, wander guard/roam alert. Option B, lock the patient in their room. Option C, tie the patient to a chair. Option D, keep the lights off. The correct answer is option A, utilizing a wander management system, wander guard/roam alert. Utilizing a wander management system, wander guard/roam alert. Question 69. If a patient has global aphasia and has difficulty understanding or producing language in speaking, reading, or writing, how should the nurse aide try to communicate? Option A, gestures and pictures. Option B, speak louder. Option C, write long letters. Option D, stop trying to communicate. The correct answer is option A, gestures and pictures. Gestures and pictures. Question 70. What is the purpose of a palm cone? Option A, to prevent contractures of the fingers. Option B, prevent infection. Option C, improve circulation. Option D, reduce swelling. The correct answer is option A, to prevent contractures of the fingers. To prevent contractures of the fingers.